Vaccine czar Carlito Galvez says vaccine supply is no longer a problem. The next goal is to immunize 1.5 million Filipinos daily. How can we lock on to this target? Let's get the insights of health reform advocate Mike Vergara, who was part of the so-called Oplan Alis Disease Program nearly 30 years ago, where millions of Filipinos were inoculated in a matter of days. Doc Mike, thank you so much for joining us on The Final Word. There are now close to 100 million doses in the country. Around 26 million of our kababayans are now fully vaccinated, and more than 55 million have had their first dose. Can we now inoculate 1.5 million of our kababayans daily? Is that achievable?
It is achievable depending on the strategy that we use. No, I will say yes, it is achievable. No, but we have to get the private sector involved. If we do the same tactics that or strategy that we have been doing in the past, we'll never get close to 1.5 million a day. We have to get the private sector involved. No?
How can the private sector be involved?
How can they get involved? One, no, let the pharmacies, no, be able to give that injection. Let clinics, selected hospitals, government and private, likewise, no, be part of the outlets where they can give the shots. Okay. All around the country, okay? Let it be, let people be able to walk in. No more prioritization, okay? Of course, it's really best that we give the people with comorbidities a fast lane, no? Or even those the elderly, a fast lane. But anybody who is qualified can just walk into any clinic, no? In their LGU, no? Or any hospital, or selected pharmacies that have a cold chain, no, that can support a cold chain and get their shots.
But Doc,
that way we can reach 1.5 million a day.
But Doc, all of these vaccines which have been currently approved are still under an emergency use authorization and a tripartite agreement. Is that why we have not seen yet these vaccines like Sinovac, Pfizer, Moderna, Sputnik, and AstraZeneca being sold in the pharmacies?
Yes. You can't sell it yet, no, because it is used. The license to give it is on an emergency basis, no. It's not yet commercially available. No, you cannot. You still cannot sell it. Okay, so it is free. If ever you have to pay for something, maybe it's the services. Right. No. So, but in order to give 1.5 million shots a day, it would be best that it be given for free to anyone who needs it and anyone who wants it.
Doc, you were one of the chief architects of the Oplan Alis Disease Program, which was a platform to eradicate polio in the country with the late Secretary and former Senator Juan Flavier. You were able to inoculate 24 million Filipinos in 2 days. How were you able to achieve this?
Okay, first, we were able to inoculate 24 million people in 2 days. Okay, in 2 days. No, and we achieved this by the help of the private sector. Okay, imagine a cold chain, no, where you have to have the vaccines in refrigerated trucks. So we asked the private sector, no, and I will mention because I'm very thankful with the San Miguel Corporation, okay, who provided their cold chain, their refrigerated trucks, no. All the way to the provinces, from Luzon all the way down to Tawi, no, and they carried our vaccines to all these places and islands, no, the boats with refrigerated cargo, no, they carried all of these all the way to the islands, and then we had many volunteers. As soon as they got to the islands, our barangay health workers would get it, put it in styrofoam boxes, and the volunteers from teachers to healthcare workers, they would go to the mountains immediately, no? And go house to house and make sure that everybody who needed the vaccines would get the vaccines. It was an effort that the whole country participated in. I see the likeness to this pandemic, okay? It is a war. We should all participate. Not only the government, not only the DOH, not only the DILG, but every Filipino citizen should be part of this war against COVID.
And I do hope that everyone who's listening to us now, the private sector, the government, will be able to hear this call that everyone has to really work together to fight this war, because we continue to face other variants from Delta and maybe even more down the road. But realistically, with this 1.5 million doses daily, Doc Mike, can we attain
and this is the time to put the stranglehold on COVID. Okay, because it's going down now, and we're approaching the Christmas season. Okay, the problem with the Christmas season is families will get together again, clans will get together again. So we expect another increase, another surge come January. Now we can prevent that if we starting immediately. If we get together and immunize that 1.5 million. People a day. So let's get the private sector involved. Open up the pharmacies, the clinics, the hospitals, maybe even schools. The nurses of schools. Teach them. We can volunteer. Ask for nurses who are at home, or doctors who are retired. I'm 62. I'm almost retired. I can volunteer. Others can volunteer and watch, after the injection, after the jab, you have to watch for side effects and all that stuff, Then the retired doctors like me, we can watch over the patients and until they're okay, then go home.
And I do hope, Doc Mike, that the government and the private sector will indeed heed your call. Thank you so much for joining us on The Final Word, Dr. Mike Vergara, Health Reform Advocate.